morning, everyone. My name is Carmen Martano Velazquez, BSN1. I'm from Iligan Medical Center College, your nurse student for today. So for today, I am going to perform a return demonstration about bed bathing. Bed bath means you're going to wash a patient in his bed, and it is very important because it helps the skin from infection. It also helps to relax the patient and make her feel better. But before we start, of course, we have to perform the hand hygiene. To protect myself and of course my patient as well from infection and cross-contamination. So now I'm going to close the door and draw the curtains for the privacy of my patient. I have already adjusted the room temperature and provide adequate lighting for my patient. Third, I already prepared all the necessary materials and equipments that being used for this procedure to conserve effort and energy. So we have here water and of course the essentials. So what I'm gonna do now is to introduce myself to my patient and identify my patient through two identifiers to make sure that I'm doing the right procedure on the right patient. And of course, I have to explain the procedure that I'm about to do to my patient. Good morning, ma'am. I'm Claire Velazquez, your student nurse for today. See your response, ma'am. Please state your name. I'm Justin Cassandra. And your birthday, please. October 2, 2002. Okay, thank you, ma'am. So for today, I am going to wash your body and to remove dirt from your body and of course to make you feel relaxed and feel better. Is that okay, ma'am? Yes. Okay, so now I'm going to wear my gloves. Okay, so in the hospital setting, naturally, you have to adjust the bed into your working height. After that, I have to assist my patient to move closely to me. So, ma'am, I need you to move closer to me, ma'am. Is that okay with you, ma'am? And after that, I have to drape a bath blanket to my patient. Ma'am, can you hold this for me, please? And now I'm going to remove the top sheet beneath the bath towel. And now I have to remove the patient's gown. So if the patient have a kind of surgery, then you have to start with the unaffected area. So after removing the patient's gown, now I have here the wash basin with warm water. It's about 2/3 full and 43 to 60 degrees Celsius. But first, let me ask the patient if it is too hot or too cold for her. Ma'am, let me give you your hand, please. The next thing to do is to remove the pillow to the patient's head and place a bath towel under my patient's head and over his chest. Do you wear your contact lenses, ma'am? So now I'm gonna start cleaning the eye of my patient, starting from inner canvas to the outer canvas. So first thing to do is to soak this towel into this water. And I'm going to wash my patient's eye. Then dry it thoroughly. After washing the patient's eye, the next thing to do is to wash her forehead, cheeks, nose, ears, and neck. If the patient is unconscious, then we have to wash her eyes with warm water only. Again, starting from inner canvas into outer canvas. Then, let's until eye drop to the patient's eye. If the patient has no blinking reflex, then we should keep the eyelids closed and place an eye patch to shield her eyes. So I'm gonna place a towel underneath his arm and start to clean his arm. I'm going to wash her arm through distal to proximal manner, which means from hand to the axilla. So I'm going to start washing from his hand. So I'm gonna wash her hands using a long, firm stroke. So I'm gonna ask the patient to raise her arm a little bit over her head and then to start cleaning her axilla. So ma'am, let me put it over your head. And then let's dry it thoroughly. And let's do it on the other side. Assuming that I'm done on the other side. Now, we have to use deodorant if needed. Oh no! Okay, so now let's proceed in washing my patient's chest. So I have to put a bath towel over my patient's chest. Slowly remove the blanket. Just above her umbilicals. So using a bath nip, I have to clean her chest, of course. But let's pay special attention to these folds because these folds are very prone to infections from the moist. Going to dry the patient's chest. Since my patient is a female, then I have to pay extra attention for her breast. So now I'm going to proceed to the patient's abdomen. So I'm going to drape a bath towel over her abdomen and slowly pulling out the blanket over her pubic region. Let's start washing the patient's abdomen. after that, let's dry the patient's abdomen using the bath towel. So now that I'm done with the patient's chest and abdomen, I'm going to proceed now to my patient's legs. So in order to clean my patient's leg, first thing to do is to expose her legs. So I'm going to fold the bath blanket just until the midline, keeping the perineum covered. Then I'm going to put a bath towel under her legs. So now I'm going to start washing my patient's leg using a long, firm strokes from ankles to knee and knee to legs. Okay, now that I'm done, I'm going to dry my patient's legs. Assess for any skin swelling, redness, bruising, and pain. Okay, now I'm going to start cleaning my patient's feet, and two nails. Using this warm water, I'm going to soak my patient's feet into this for 10 minutes to maintain the cleanliness of the feet. It is important to remember that we should not soak the patient's feet with soap, especially those patients with diabetes or patients with impaired sensation, because it may cause harm or any injuries to them. Now I'm done with the patient's anterior side of the body. So I'm going to discard the water, the bath towels, and the gloves that I used and replace it with a new one. Okay, so now that I'm done changing my gloves for a new one and I have already refilled my water basin with warm water, so now I am going to assist my patient to a prone side facing to the left side in order for me to clean her back. So ma'am, can you turn to the left side please? And then I am going to put a bath towel side of his back, her back. And using this towel, I am going to soak it with this warm water. And wash the back of the patient. After that, let's dry the patient's back. Okay, so if the patient's skin is intact, we're going to ask if she'd like to have a back massage. Ma'am, would you like to have a back massage? So if not, we're just going to put a moisturizing lotion at her back. Now that I'm done backing my patient, ma'am, roll back. Okay, so ma'am, I have here your new set of clothes, so let me help you to wear this. Now, let's help the patient by her grooming, starting with combing her hair. Okay, now ma'am, that we're done with your bathing, how are you feeling? That's nice to hear, ma'am. Okay, so now I'm going to head out now and let you have your rest. So if you need anything, just don't hesitate to call me using this call right here, and I'll be right here to attend your needs. Thank you, ma'am. Enjoy your rest. After doing the procedure, I'm now going to proceed to doing the aftercare of the equipment and materials that being used to the procedure today. It is in order to maintain the cleanliness and orderliness of the place. And after